So hello again, everyone. My name is Wenru Wang, and I'm a third-year PhD student at Rutgers as program. So today I will be sharing my presentation in systemic view of pandemic circumstances using analytic methodologies. And let us start. So as we all observed for the past several months, we are currently experiencing the COVID-19 pandemic, and scientists in different fields are devoting to find cures and track sources for the novel coronavirus. And researchers in social science have also tried to analyze the relationship between social factors, government policies, and the COVID-19 infection and mortality rates. So for instance, research found that large metropolitan sites results in expressively higher COVID-19 infection and higher mortality. So the metropolitan size could be resulted from government policies that are long established and implemented before the outbreak of the COVID-19. And other scholars include government policies that are made to fight against COVID as indicators to the pandemic outcomes. But these studies, they are all lack of something. First, current studies, they tend to ignore a fact that the development of an epidemic is dynamic, which means that people that are infected will recover, and recovered people will be susceptible to the virus again. So looking at the figures statically may be not very comprehensive. And second, most of the researchers, they are using data resources from government releases, but there are also reports and studies pointing out that can we really trust the numbers, because there are issues about testing and not testing, and there are issues about symptoms and asymptoms. So there are actually a gap between the actual number of COVID infections and the number of reported cases. So we think with using the current measurements, we may get conclusions using these numbers, but they are not very objective. So the last issue is that previous studies, they either only explain the long-term impacts of government policies, or they only provide limited predictions about current COVID-related government policies. So how do governments evaluate and predict the impacts of a proposed policy before it is actually implemented? So with all the concerns that I just discussed in the last slide, we want to propose these two research questions and try to provide solutions with analytic methodologies. The first question is how to evaluate and predict the impacts of the government interventions responding to the pandemic. And here we propose a system dynamic model. And the second research question is that how to improve the efficiency of government procurement under the current pandemic circumstances. So these are also the two main parts that I will talk about in this presentation. Oh, and to solve the efficiency of the government procurement, we propose a continuous audit and monitoring methodology with text mining techniques. So let's start with the first research question. So to solve this first question, we incorporate the theory of system dynamics to understand the interaction of pandemic outcomes, social factors, and government policies, and we construct a dynamic model to predict and visualize the possible outcomes of government interventions. we are using the theory of system dynamic, which is proposed by J. Forrest in 1961, and it is the science of feedback behavior in social systems. So here, because of our time limits, I will just jump to the basic SEIR model that are shown below. So the SEIR model is widely applied to illustrate different stages of an epidemic outbreak, and it considers a set of variables, including the population susceptible to infection, the people that are exposed of the virus, the people that are currently infected, and the people who recover or who die. So the SEIR model here I show in this slide illustrates the spread of COVID-19 among a large population group and how the population amount of the 4 different stages develop from one to another. So in this model, we set the 4 stages of epidemic as 5 stocks, as you can see here, as susceptible, exposed, infectious, recovered, and dead. So recovered and dead are treated as the final stage of the epidemic in this basic model, and we assume that at this stage the host is no longer able to carry the virus and the host is excluded from the dynamic model. And the stocks are connected by the arrows here, and they are called flows. So they represent how people of one stage flow out and flow into another stage. And we use dependency links to connect different different parameters and to connect the flows. And we also include calculations to calculate how different parameters impact each flow and further changes each stock. So all the values of the parameters and the initial values of the stock could be adjusted to accommodate different simulation objectives. And in this slide, I hope I could play this video to you. Okay, so it's not playing for me. Just give me a sec. Let's see. Nope. So I'll just skip this illustration. So here we actually added a simple visualization of a time chart to visualize how the amount of people in 5 stages change within time passed by. And because I don't have the visualization right now, so I'll just explain that we use this simple illustration to illustrate how an epidemic should be reviewed in different stages, and people of one stage will always flow to the other unless the person is either immune to or dead from the disease. And the governments could apply this model into the current COVID-19 pandemic, and they could use it to estimate the pandemic circumstances. They could view the released numbers of infections with the number of recovered and dead people. And with this dynamic view, it will provide a more comprehensive capture of the circumstances. For example, when we compare 2 countries that have reported high cumulative numbers of infections, we need to review the recovered number and the dead number to decide which country suffers more by this disease. And since this basic SEIR model didn't include much about the prediction of government interventions, we expand the model to include the consideration of government policy. So the model could simulate the pandemic circumstances in a way that government is currently responding and impacting the pandemic outcomes in real life. And this is a dynamic model with susceptible, exposed, testing, hospitalization, recovered, and dead. We also add different parameters as I highlighted in the bottom of the left corner, where we could adjust to simulate different levels of government interventions. And because of the limits of the technique, I could not include the visualization about the different simulations, but we basically use a simple time chart to simulate how different levels of government interventions could give us a different number of infections, a different number of hospitalizations and recovered and died amount of people. So the above discussion provides a simulation tool as to how government could predict the impacts of the policies from the pandemic development and control point of view. The following part of my presentation will be focusing on the efficiency of the pandemic reactions from the financial point of view. So, as we discussed, the different governments are implementing different types of policies and interventions to cope with the current pandemic. And of course, they include different policies in the financial view. And for example, the US government, they established the CARES Act and they announced a US dollar for 150 billion coronavirus relief fund for state and the local governments. And the COVID fund is established with a set of requirements as to what payments will qualify for this fund. And Brazil also announced economic stimulus package with a US dollar of 17.5 billion financial support to their states. So we will ask that how does the government spend the fund? Some will answer that with the current electronic procurement system, government will know how did they spend and where did they spend the money. But there are also data quality issues in the procurement system because they usually include different departments and some of the staff, they will understand the system differently. So they will input the record differently, or maybe they are not in accordance with their regulations. And also, although there are governmental audit, there are actually time lagging between the actual error and the anomaly detection, which means that when a government audit found the error, it may have already passed a long time after the error actually is incurred. So here we propose a continuous audit methodology that could help internal auditors monitor and analyze government procurement data on a more timely basis. So we work with the audit team of Rio de Janeiro City Hall, and we focus on their medication procurement data. And currently we have over 30,000 records of medical procurement for the year from 2017 to 2019. And we, for now, we have over 7,000 for the year of 2020. And as the picture shows, we use a 4-step approach to conduct the study. And we first pre-process the procurement data so that they will be ready for further analysis, because there will be some misclassifications because of the procurement system limitation. And through total value ranking in step 2 and the unit value comparison in step 3, certain alarms will be triggered and sent to the auditors. The alarms, including medicines of high total purchase values, and the alarms will notify auditors to investigate on these medications. We also generate a monitoring dashboard at step 4 for auditors to easily view the alarms and can trace back to questionable procurement records. And because of our today's time limits, I'll just jump to step 2 and step 3 for some illustration about our current progress. So at step 2, after the first step of data cleaning, we have all pre-processed data goes to the total value ranking, and we identify top purchased medications in 2020, and we compare to the top purchases in 2017 to 2019. So we use the top purchase list of 2017 and 2019 as a base, and we compare to the base. So looking at the 2020 top list, we found that 10 out of 20 top identified purchased medications, they are not included in the base. So meaning they are not purchased at high value from the year 2017 to 2019. And very interestingly, the 10 medications, they are either antibiotics or they are drugs or anesthesia used for surgery. So as I highlighted here, the 3 red blocked medications, they are used for surgery or anesthesia, and the yellow blocked medication is actually used for the cure of asthma. So actually looking at this medications, we could suggest that the hospitals in Rio de Janeiro in 2020, we could tell that there are more patients that are going under surgery, and they are buying more medications to fight with the COVID or COVID likely diseases. And looking at even for the medications that are purchased before at high values, we highlighted 3 medicines here that they are purchased at extremely high total values this year. So as you can see, the left column is the year of 2020, and they are purchased at very high compared to the red column. These are the value that they are purchased in the base years. So they are purchased in 2017 to 2019, but they are not purchased at very high values. So from this step, we know that more antibiotics, surgery-used drugs are purchased, which means that, as I mentioned, the hospitals, they have more surgery patients, and more patients are in need of cures for infections. So this step could help auditors immediately identify medications of great values, but are not purchased before, and also highlights the need of usage management, because as we identified certain medications, they are very dangerous, such as they should be used with caution, and they may cause social problems if the management is ignored. And then we go to step 3, the unit price comparison. We first do the comparison vertically, which means to compare the purchases of the same medication within the municipality. And we identify medications that have large unit price variations, which means that some hospital, they are buying the same medication, but they are buying at a higher or extremely higher unit price than other medications. And the auditors of Rio de Janeiro, they want to identify these hospitals so that they will be presenting with possible price savings opportunities. And here, looking at the 10 medications that did not show in previous top 20 list, we found a very interesting fact that purchasing more medication at higher amount does not mean that they are purchasing at a cheaper unit price, because normally we will think that if a hospital is buying at bulk, they will be buying at a discount price. But looking at the 10 medications of high values, we found that looking at the highlighted rectangles here, actually for those that are buying at a very high value, which means that they are buying a lot, they did not actually get at a very good price. So meaning they maybe spend more than other hospitals that actually they are only buying at a small amount of the same medication. So that will be a question that the internal auditors want to look into. And here I just want to illustrate a price savings opportunity that with the lowest unit price of one medication, it could save the hospital over 800,000 real dollars in purchasing only one type of medication. And we also do a horizontal comparison in step 3, which means we compare the unit price to federal catalog prices in order to detect record mistakes or resources abuses that are ignored in previous steps. Because actually some of the medications, they are only purchased by one organization in one transaction. So in the previous step, we could not identify other records to compare with. So we come to this step and we compare to the federal catalog prices to find possible price saving opportunity. And at this step, we currently, the federal catalog, they do not provide information about prices and quantity to download as a data set. So we only do a fuzzy matching between the Rio de Janeiro municipality catalog and the federal catalog so that we could locate the correct federal coding quickly to look for the prices using a different panel. And here is an illustration of the Brazil federal government material catalog, and you could see that they only have the material and the codings, and they do not have the prices and quantities. And here is an illustration about the fuzzy matching that we do between the two catalogs, because the two catalogs, they do not share same codings for the medications. So we do a fuzzy matching using name and description to locate the right federal code for the medicines. And here, the left column is actually the codings in the municipality catalog, and the red column is the coding for the federal catalog. So after locate a correct federal coding for medication, we could go to a different price panel to look for the medication that are of our interest. And this is an illustration of the website, and we actually look for a medication that is also buying at high value in 2020, and we found that actually Rio de Janeiro is paying higher than other states in Brazil. So the highest value is 110 for the unit price, and the lowest value for the same medication in Brazil is actually only under 20. So here the auditors may want to look into and see why other states could buy at a extremely lower unit price to save some budget. So to sum up my presentation, I present a dynamic model for evaluations of the government policies responding the pandemic, and also I propose a continuous audit methodology to improve the efficiency of government procurement under the current pandemic. And with that, thank you very much for your attention.